Hello, welcome to my channel Deep Learning Biology. My name is Dr. Vikash Bhardwaj. Now through this video I am going to teach you about a disease infection known as syphilis. So in the applied zoology course today I am going to teach you about syphilis. Now here I just want to tell you that syphilis, it is actually sexually transmitted infection. Sexually transmitted infection means this infection can pass from one person to another person through sexual contact. Now here keep in mind the bacteria which is responsible for causing syphilis, it is Treponema pallidum. Treponema pallidum. Now here you can see the picture of this bacteria, and if you see this bacteria, it is long spiral shaped, thread like, and here if you see the name Treponema, trepo, here it means turn. Within the bacteria you are going to have turn, spirals, nema, thread like. So here keep in mind Treponema pallidum, okay, it is the bacteria which is responsible for causing the disease syphilis. Now let us learn more about this bacteria. So here Treponema pallidum, if you see this bacteria, it is helical in shape. It is helical in shape, and here if you see this bacteria is actively motile. Another important point, keep in mind this bacteria is gram negative. This is gram negative. So this bacteria is not going to pick up the gram stain. Very important point, this bacteria is anaerobic microaerophilic. Anaerobic microaerophilic means it requires very less concentration of oxygen to survive. The most important point here, keep in mind this bacteria is obligate intracellular parasite of humans. So it is obligate intracellular parasite, means it can't survive without its host. So hopefully you know there are two types, one is obligate, another is facultative. So here this bacteria is obligate intracellular parasite, and here keep in mind the host, the only reservoir host for this bacteria is we the humans. Okay, so this is some basic about this bacteria. Now here if you see this bacteria, the pathogenic Treponema pallidum, it can be visualized only with the help of special type of microscopy, dark field microscopy, or you can use phase contrast microscopy. Another important point here, keep in mind this bacteria can't be grown in artificial culture media. You must be knowing you can grow bacteria in artificial culture media, but here this bacteria can't be grown in artificial culture media, and I have told you this bacteria can't be visualized by simple microscopy. What you have to use? You have to use special kind of microscopy like dark field microscopy or phase contrast microscopy. Now here a question will arise in your mind, why we can't visualize this bacteria by simple microscopy like light microscopy? The answer is simple. This bacteria generally do not pick up the stain which are generally used to visualize bacteria. Okay, so that's why we are going to use special type of microscopy, that is dark field microscopy, or you can say phase contrast microscopy. Now another important point here, I have told you, we can't grow this bacteria in artificial culture media. So scientists who generally work on these bacteria, generally they maintain these bacteria in susceptible animals. So generally they maintain this bacteria in rabbit testes. Okay, so hopefully all the points they are clear to you. Now let us move further. Let us discuss the classification of this bacteria. If you see the classification of this bacteria, it belongs to the domain Bacteria, phylum Spirochaetota, class Spirochaetia, order Spirochaeales, genus Treponema, and the species is pallidum. So this is the classification of bacteria: domain Bacteria, phylum Spirochaetota, class Spirochaetia, order Spirochaeales, genus Treponema, and species is pallidum. You can see this is the picture of the bacteria. Now let us move further. Now here I just want to tell you, if you see this bacteria Treponema, okay, it is going to have endoflagella. Generally in the case of bacteria, what you are going to see, flagella, and these flagella, they are responsible for movements. Okay, when bacteria they have to move from one place to another place, generally they are going to use their flagella. In the case of Treponema, what you are going to see, endoflagella. The flagella is absent, but here what you are going to have, endoflagella, means the flagella, it is present. Okay, so here 3 to 4 flagella, they are present within the periplasmic space. They are present within the periplasmic space. Hopefully you know what is periplasmic space. So if you see the bacteria, what you are going to have, cell wall, then you are going to have plasma membrane. In between cell wall and plasma membrane, you are going to have space, and this space is known as periplasmic space. So within the periplasmic space of Treponema, what we are going to have, 3 to 4 flagella, and here these flagella are endoflagella. Now these endoflagella, they actually help this bacteria in tissue invasion. These endoflagella, they help this bacteria in tissue invasion. If the bacteria has to pass any kind of tissue, they can do this, and this they are doing with the help of endoflagella. Now here if you see the transmission of this bacteria, I have told you this bacteria can be transmitted from one person to another person through sexual contact. Now let us suppose there is first person A, and he is suffering from the disease syphilis. Okay, so what you are going to see in this individual who is suffering from syphilis, okay, initially in that person, what you are going to see, formation of one chancres. Okay, so wherever these bacteria are going to infect, okay, so what they are going to produce, they are going to produce chancres. These are small, painless, hard, shore pimple. These are small, painless, hard, shore pimple like. Okay, so within these chancres, what is there, the bacteria is growing. Okay, now here generally these chancres, they are being present on the genitals, rectum, within the mouth. Okay, so these small, painless, hard, sore, pimple like chancres, they are going to form, and generally most of the times what is going to happen, the individuals, they are not going to notice this because this is painless. Okay, now here let's suppose there is, I have told you there is a first person A, and he is suffering from the disease syphilis. Okay, now through sexual contact, okay, through sexual contact, by exchange of body fluids, or even during the time of kissing, okay, these chancres from the first person A, they can pass the bacteria to another person B. Okay, so here keep in mind, this bacteria can be passed from one person to another person through sexual contact. That's why we are saying this bacteria, okay, the disease syphilis is actually sexually transmitted infection. Now in the person B also, what you are going to see, formation of syphilis chancres. Okay, now in the person B, what you are going to see, there will be initially formation of syphilis chancres, but these chancres after few weeks, after few months, they are going to, you can say, heal. They will just go away, the sore, it will go away, and the person will think that everything has healed, there is no problem, but in actually that is not the case. Now try to see here. So when this sore goes away, so here in actually the infection moves to the second stage. The infection, it moves to the second stage. Try to see here what actually happens. So in the second stage, what is going to happen, you are going to see rough bumpy syphilis rash, rough bumpy syphilis rash on the entire body. Okay, so the person B, okay, in the second stage, they are going to have rough bumpy syphilis rash, and these rough bumpy syphilis rash, they will appear on the entire body, or it can appear on palms, soles of the feet. Okay, so here you see in the first stage you are having chancres, okay, small chancres, painless, but in the second stage what you are going to see, formation of rough bumpy syphilis rash on the entire body. So hopefully this is clear to you. Now here, if you see in this stage, okay, in the second stage, the individuals, they are going to have fever, fatigue, weightlessness, headache, hair loss, swollen lymph nodes. So these symptoms are also going to appear. Now here I also want to tell you that in case of syphilis, you are going to have different stages. So here I have told you, one, you are going to have primary stage, another you are going to have secondary stage. Okay, so here keep in mind, when the syphilis, the individual is suffering from syphilis and syphilis is in primary stage or in secondary stage, then the individual, they can pass the infection to others. Okay, now if the individual, the person B, is not going to take any kind of treatment, okay, if they are not going to take any kind of treatment in primary and secondary stage, okay, there is a lot of chance the disease will go in latent stage. The disease will go in latent stage. Now try to see here what is going to happen when the individual is going to have latent stage of syphilis. Try to see here in the latent stage, what is going to happen, these bacteria, they can last up, they can survive up to 20 years within the individual body. And here generally, if you are going to see, the symptoms are mild. Symptoms are mild. In the individual, you are going to have mild damage to heart, mild damage to bones, mild damage to nervous system. Okay, so this is about the latent stage of syphilis. Now here keep in mind, in 20% of the individual, 20% of the people, what it can happen, the disease can go in the next stage, and here the next stage is late syphilis phase. Late syphilis phase. Now try to see here what is going to happen in the late syphilis phase. Here keep in mind, in the late syphilis phase, the individual, the patients, they are going to have some severe kind of symptoms like brain damage, dementia, heart problems, movement disorders, muscle problems, nerve damage, seizures, vision problem, blindness. So here in late syphilis phase, the individuals, they are going to have serious symptoms like this. Now here you can see in the picture how the individual, they are going to appear when they are going to have this late syphilis phase of the syphilis. So here I have told you that syphilis, okay, it can be in different stages. So in primary stage, secondary stage, I have told you the individuals, they can pass infection from one person to another person through sexual contact. Yes, here I also want to tell you, when there is latent stage or late syphilis phase, in this phase the disease can't be passed from one person to another person. Can you tell me why is this? Okay, I would like to know. Okay, just try to figure out, and you have to tell me why the individuals who are suffering in latent stage or they are in late syphilis phase, they are unable to pass the disease through sexual contact. Okay, but keep in mind, when the individuals, they are in primary stage, when they are in individuals, they are in secondary stage, they can pass the infection to others. Okay, now here keep in mind, I just want to tell you about congenital syphilis. Congenital syphilis. Now try to see here. Keep in mind, this disease, if you see syphilis, it can be transmitted. Infection can be transmitted from infected mother to the fetus, the child. So during the pregnancy, okay, if mother is infected with syphilis, okay, now the infected mother can pass the infection to fetus. So here who is going to suffer? Mother is already having the disease, okay, and mother can transmit now the infection to the fetus. So here if you see in the fetus, what you are going to see? Several health problems. You are going to see several health problems. Here in 40% of the cases, the fetus, they are going to die. But in the rest of the cases, if there is going to be birth, the individuals, the baby, they are going to suffer from the disease congenital syphilis. Congenital syphilis. So hopefully it is now clear, okay, that syphilis can be transmitted from one person to another person through sexual contact. Another, the syphilis, it can be transmitted from mother to the child, baby. Okay, so hopefully all these points are clear to you. Now at the end, I just want to tell you, if you see the treatment of the syphilis, yes, this disease is treatable, the infection is treatable, and for all stages, if you see, the drug of choice is penicillin. If anyone is going to have the disease, okay, and if they are going to find they are in the initial stage, yes, they must consult the doctor, okay, and here keep in mind, the drug of choice is penicillin. So hopefully through this video you have learned clearly about the disease syphilis. Keep in mind the disease syphilis, it is being caused by a bacteria, Treponema pallidum. And finally, I just want to remind you that this syphilis is sexually transmitted infection. It can be passed from one person to another person through sexual contact. Another important point, keep in mind that yes, this disease can be passed from infected mother to the child. Okay, so hopefully you have learned basically about syphilis. Please do like, share the video, and subscribe to my channel Deep Learning Biology. And if you can support us, bye bye, take care.